everybody. I'm Angela Hart. Welcome to the Hart of New York show. We're filming a series of shows about caring for seniors, and we've invited a team here from Independence Care System to share some of their services and experiences with us. The organization is an MLTC, and so I've asked my co-host, Ellie Goldbaum, to join me today.
Thank you. How are you, Angela?
Very good to see you, Ellie. And so we're going to have each of the people from this organization, which is a nonprofit healthcare organization, introduce themselves, starting on my left.
I'm Nettie Harper, and I am from Independence Care System, as you mentioned, and I am the program director for our dementia.
Thank you.
My name is Bob Paradiso. I'm a rehab engineer for Independence Care System.
Thank you. We'll be talking a lot about how the Independence Care System has access for seniors who need help with light engineering issues in their home, and it's a wonderful service that you offer. And you, would you like to introduce yourself?
Sure. My name is Dee Visco. I'm the director of our wound care team at Independence Care System.
My name is Danny Perry. I'm the Director of Community Engagement at Independence Care System, also known as ICS.
Thank you, Danny. Welcome, everybody. So we were speaking about wound care and how it affects the economy, how it affects the residents and the seniors who get these wounds. And we wanted to continue the discussion to see about the financial aspect to it.
Sure. To us as a team and a philosophy, to me the impact to the individual is always the key, their quality of life. But financially, it can be a huge drain. A single wound, and when we talked about pressure injuries, just to remind everyone, it's damage to the skin. That could be anywhere from superficial down to muscle or bone. Estimates go anywhere from the low end of $20,000 per incident in the high 100, 120, 150 or more, depending on what needs to be done. Now that involves hospitalization, potential surgery, IV antibiotics, home care nurses to go out and do skilled nursing care for the wound. Wounds can take anywhere from weeks to years to heal.
Oh my goodness.
For individuals with multiple wounds, the financial burden can be really extremely large. Again, to me, we always at ICS think about the financial piece, but the quality of life piece we see every day. We see the impact for those who can't take care of their children. I think of one young mother who had a physical disability who couldn't care for her school-age children. Those seniors who most important to them is to attend a religious service, and they can't attend the service because they have to be in bed, because they have a sore somewhere on their body.
Oh.
So the financial piece is tremendous, but I think the quality of life piece is what we really try to focus on for our folks.
But while we're on this financial side to it, if they're on the MLTC, they're not paying for it, are they, if they're a member of the organization?
Paying for the services?
Right. You
no,
said
we're
the
taking
cost
care
is...
Well, the cost to Medicaid and to Medicare and to the federal and state governments, hospitals, yeah, it's all entailed because everything involved in that care needs to be paid for, not by the individual because they're on the plan, but eventually by the state and federal government because they need a special chair, they need a special cushion, they need IV antibiotics, they need hospitalization, they need a surgeon. So all of those cases add up, and that's again why we really focus on the preventative piece, because prevention is so much easier and so much more cost effective than treatment. And I think often there are those who think very within the box in terms of what we can do to treat these or prevent these. At Independence Care System, we really think way outside of the box. So I had previous experience. I had worked at a CHA, Certified Home Health Agency, where we really were very much by the rules of the Medicare and the Medicaid, and that sometimes tied my hands in terms of what I could get for an individual in terms of equipment or services. At ICS, if there's a need for it, we get it for the individual, which I think is unique, and it's probably why I've been there 16 years now, because really we have been able to impact the quality of life of hundreds and hundreds of different individuals.
So I have a question for caregivers who are still have their loved one at home with them and who are not on an MLTC plan. What can you suggest to them for prevention or to be on the lookout for?
The biggest thing is education. Be educated. The internet is a wonderful place in some ways, but go to places that there's something called the National Pressure Ulcer Advisory Panel. There's lots of lots of wound care sites that talk about prevention. But there's wonderful literature out there that talks about what can you do, because education is the key. my husband's a military guy, and he says is forewarned is forearmed. So
love
if
it.
you know what you're doing going into it,
Yes.
then you're going to be prepared. And it doesn't need to be complicated. It's knowing if I'm caring for you as an elderly parent, what do I look for? How do I keep you moving? How do I take a look at your skin a couple times a day? How do I get you engaged so that you're moving to prevent this? If you know what causes it, because in order to prevent them, you first need to know what causes these. How do I get these? Most people think immobility. I can't move because I'm weak, because I'm aging, because I have a new hip. But the bigger piece is for those who can move, but because of severe depression, do not move, which happens with isolation with the elderly sometimes, because of dementia. They're very capable of getting up and moving, but we need someone to say, hey, you've been sitting, let's take a little walk. Let's walk from here to the kitchen and come back. Let's take a stroll outside. So it's really knowing what can cause the wound and then knowing what to do. And they're not really complicated interventions. They're very simple, but you need to have that knowledge in order to be able to prevent.
That would be great if you could put that on your website. Do you have something about wound prevention on your website?
We actually, we have great tools that we use. They're called stoplight cards that we give to the families and the caregivers that, have a red, yellow, green. The green is great, everything's going good. Yellow, let's think about what we need to do. Things are, and then red, where we really need to aggressively address it. So we have those for all different types of conditions that our members might face.
Thank
We
you.
also have a wound care tip sheet as well.
Yes.
And so if people go to our website, doesn't have to be a member, website's www.icsny.org. They go to our specialized programs. They can see all of our specialized programs and download tip sheets, including a tip sheet for our wound care and prevention as well.
Thank you. And viewers, I think you'll find that helpful that we're going to put the website address as we're speaking about this, because a lot of viewers who are not members of your organization yet could benefit from having a tip sheet. When I meet with caregivers such as yourselves, I always wonder what got you involved in this end of the business, particularly with seniors and caregiving type, professional caregiving industry.
Sure, great question. So it started in college. I went to the University of Florida, and go Gators. And so basically I wanted to kind of round out my resume so I could get into law school, and so I went to the Career Resource Center, and they sent me to an adult day program for individuals with memory impairment, and I absolutely found my passion. I had no clue, but I found my passion. I volunteered there for 6 months, 3 days a week, and then decided I'm going to go back to grad school for recreation therapy. So I became a recreational therapist. I had to go into where I was volunteering and ask them for a job, though, because I needed to pay for graduate school. So that's where I found my passion, and then I've not looked back since. I've been very blessed to meet the individuals that I work with and their families, and I learn from them every day. It's their wisdom that keeps me going.
And how many years have you been at this?
Over 20.
20? You look
Yes.
so young.
Thank you. I'll take that.
Yeah, that's wonderful. And how about you? How did you get involved?
I like Nettie, more than 20 years. Had worked on a surgical floor when I first got out of college and was working as a nurse, and worked with some plastic surgeons, and had many members or patients at the time coming in with wounds, and really wanted to help them heal. It's the interesting thing about wound care, and most wound care nurses will tell you, it is right there. It's visual. So many diseases that are happening and illnesses with the body, you can't see it. When a wound that is really terrible and huge and infected goes on to heal, and you see that individual gain back their life and their quality of life, it's huge. So it's very rewarding.
I'll bet it would be.
So it's that kind of was the impetus, and I've been with it ever since.
Well, I give you all credit. I'm so squeamish when it comes to those medical kinds of things.
I used to work in a nursing home. They took pictures of all the wounds. And we used to open the charts, because we had to work on the charts. And
You'd say,
I'm squirmish.
I
like
could
you.
do without the picture, right?
But I understand what, where Nettie and Dee are coming from.
Oh, of
the reality
course.
is that when you get involved and you help people, as we do all the time, you just feel it's a real rewarding thing that you're helping people in a time that's very vulnerable. And there's so many people out there that are just lacking information. You talk about the wound care and other things, just getting information out to people that they can go ahead and actually use it for their particular case. I always say that people are thrown into healthcare. Very often they don't anticipate it. Everyone, we're all living forever, and everyone's going to be well on. No one thinks about the fact that Someday, all of a sudden, something happens. You know, in our office, we see this all the time. You know, what happened? Oh, mom all of a sudden had a stroke. They had, you know, the hip or whatever it is that happened, and they don't think about the need to take care of their parent, or think about, you know, we're not living forever, we're not going to be healthy forever. And these are the type of things that I think, you know, we spoke about the wound care. People don't understand how people are susceptible because they're starting to lose the functions, and then all of a sudden you get to these situations where they don't even realize if you're not going to watch, you're going to develop those wounds or the diffuse or whatever the case may be.
And I think just what you're saying, I think it's important that when we do get these diagnoses, whether it's a wound or you're getting a diagnosis of some form of memory loss, that wherever they're receiving that diagnosis, that they're given some hope as well, because these things are not death sentences,
Correct.
and we still need to live. And I think if we just reach out, especially in New York City, there are so many resources out there that if they knew about it, they would understand that there is still living to be done, because so many families I've met, as soon as they get the diagnosis, their initial reaction is to isolate the individual because we have that supportive and protective need, whereas what we're developing then is we're causing the individual to have that learned helplessness. So then they're not doing anything from themselves. And that is when you have the person who's sitting in their chair all day long, and they are going to develop those needs. So what Bob does and the pre-education that you give, and then what we do, it all kind of combines together to give that independence back to the individual so that they can have that quality.
I hear a lot from you about client-directed care. How is it possible when someone is in a state of Alzheimer's or has dementia that they can be still directing their care, if I may be so bold to ask?
It's a great question. And I think what happens is it goes back to the education piece, that yes, there's a memory loss, but so often if we allow them the time to process our questions, and research shows it takes about 20 to 30 seconds for someone to come up with their response. And
What, you mean everybody, or you mean someone with
for
dementia?
someone with a memory loss,
So we need to be more patient. You just made me feel so guilty
Absolutely.
about some relatives that I'm not very patient with or
And you
haven't
know
been
what?
patient with.
We should not feel guilty. That's going back to the education piece. We don't know if we're not educated on it. And so that's part of what we do when we go out to the home and we're doing our visits. We're meeting with the home health aide, we're meeting with the families, and we are working with the client one-on-one. And so therefore they can see how we are demonstrating how to work through questions, and then they can learn that process. But they didn't know. So we can come up with the answers and then allow them to give us what would they like to do in the morning. What would they like to do for their interests or passions? And then we start in ICS, Independence Care System, we develop what are called rhythms. So clients on our team, the dementia team, they all have rhythms so that the aides and the client know kind of what they're doing throughout their day. So they learn to expect it, which taps into that procedural memory, and then they know what's coming. And they've been part of the choice.
And they look forward to it.
Absolutely, absolutely.
That's exciting. Bob, do you have any testimonials or experiences that you've had with clients that were rewarding or touching that you'd like to share with the viewers?
Sure. Okay, so at Independence Care System, I've done, a range of things. There's the off-the-shelf things we looked at last time, the quick things that you could just set up, and we've also gone beyond and done some custom, kind of larger projects. And one woman who comes to mind, I did a number of things for her, including we set up her hospital bed so it can raise and lower with her voice, so she can talk to, in her case it was Amazon Echo, but it could also be the Google product. You talk to this voice-activated thing, then it talks to the bed, and the bed will raise or lower. So she didn't have the hand function to use the bed control. But you wanted, I would want it, that independence to be able to, like if you're uncomfortable, to have the bed move. And further, she wanted to be able to raise and lower her window shade, which, is a valid request. It's nighttime and you have a street light, glare coming in, and you wish the shade was down so you could sleep better. Or, in the morning the sun's up, you kind of want the sun to come in. So to give her the independence to be able to raise or lower the blind. Let's see, I set her up with that, and then also, but while I was there, I did the easy, quick hit things. I set her up with all the lights she could turn on or off, and also with her TV. And she can do a lot more now on her own. So that felt pretty good at the end, yeah.
That's rewarding. I know that I'm I'm very conscious of my environment, and I'm a person who wants to control the heat, the coolness, the lights,
Yeah.
the glaring. This is bothering me, my poor husband. Can you turn that? Can you lift that? But imagine, you think about when you're vulnerable at such a stage when you can't control those minor little things around your environment. It must feel awful. So that's a wonderful service you offer.
Bob, in your house, did you have all these things set up?
You know, what I have in my house is just piles of boxes of these things. It's like the warehouse for these things.
You
but,
get home and it's just like you're finished with it for the day.
Yeah.
I think the great thing about this is that all these programs kind of work off of each other, you know? So Dee was talking about the wound care, but the wound care might be tied to dementia, and Bob coming in kind of helping people become more independent. Might be someone who has dementia or has a wound and is not mobile. So all of our specialized programs really kind of work off of each other, and there's great internal communication. So the focus of the organization is to keep people as independent as possible. So these specialized programs that are unique to ICS really allow us to position our members to help themselves and be as independent as possible. So that's a real big focus of ours.
I'm hearing that.
Do most of the members have caregivers that are very active in their care, or a lot of the people, what do you do with people who don't have caregivers that are that active, or, you know, they may only get a certain amount of hours from a home health aide and they're sort of left alone for many hours?
Well, so that kind of goes to what I was talking about with Bob. Obviously, people need care in the home, and some people need more care than others, but we're trying to empower people and try to find assistive services or some other kind of non-pharmacological way of supporting their efforts to be independent in the home. So, you know, there's cases where someone might need more hours of home care, but we're also trying to find, you know, unique and specialized ways to help people be as independent as possible. So it's a combination of all these things.
And I actually have an example of a visit that I did this week. It's an individual with memory loss, and she was looking for her restroom, and she ended up in the hallway, and then she got kind of turned around. And so we just did a simple visit, and basically I was just kind of I was showing these cloths that were very brightly colored, and I asked her what her preference was, and she kept being drawn to the orange no matter what I gave her. So I knew that I call them templates. So I made a template to put on the door that just kind of redirected her back to her home. And so she has one on the outside, one on the inside, and kind of protecting her privacy as well. So we made it, you know, what would she like it to say? Again, giving her that choice and that independence. And then we also, there's a thing on the market called the Rosie Clock, that basically you can put 25 messages on there and you can time it. So she was getting a little bit confused of the time, and so her son is recorded as saying what time it is, and Mom, this is the time that you wanted me to remind you to go to bed. So again, it's creating that independence, and she does not have a night aid. The other thing that we did is, you know, some individuals have bedside commodes, but we don't think, well, it's gray. It kind of blends in, and as you know, age, we get this kind of yellow film on our eyes, and everything kind of really looks the same color. So again, I put the orange on the handles of the commode, right? These are not expensive things, but you have to go in and do the assessment to see what are their strengths. It's all playing to their strengths. And what Bob's doing with the dexterity, if they have the trouble with dexterity, but they have their voice, that's their strength. So let's figure out what their strengths are and then build the non-pharmacological intervention up. Because pills are not going to help her. The pill is not going to help her in this situation. But learning that the orange worked, the sign worked, and you have to test, can she read? And what font can she read? Those are the strengths that we're looking for.
Now,
So how do you deal with the patient that you mentioned before, patient going in and out of their house, dementia patient, they get lost, they wander?
So for this particular individual, it's only been 6 days, but that's 6 days of safety, right?
Yes.
So the other thing is, you know, and I know for a fact because this particular individual has a camera so her son can see, so we know she's been safe for 6 days. As I keep saying, people with memory loss can learn. And so she was able to learn that this sign, that's the wrong way. Because if you looked at her environment, it was all white. All the doors looked the same.
Yeah,
So she
yeah.
needed it to stand out that that's the front door. That's not the right direction.
now, what is your title again at Independence?
The program director for the dementia.
Are all of the people in your capacity trained and caring as you are to notice these ideas about color and apply that? That's not clinical training. I don't even know how to, that's intuition almost. It's a gift.
Well, thank you. However, we've actually done a lot of research in these areas. It's out there. And so the practitioners that are on the team, the nurses, the care manager, and our coordinator, because there's a case manager coordinator that answers the phone from some of our families. So they need to be educated as well, right? So the entire team has been educated. We went through months of education, and then we, on the other side, we became certified dementia practitioners. So the entire team has been trained. And part of that training is what to do on the assessment process. And it's not about drilling with questions. A lot of it is just the simple phrase, observation, and the simple phrase, tell me more about that. And people will start opening up, because what did you do? You showed interest in them. So many times people go and do assessments and they fill out these forms, right? And then they're on their way.
Yeah.
But we actually are interested. Tell me more about what your interests and passions are, and you learn their strengths that way.
Wow, I think it affects me what you're saying about the color. That color story really affected me, because I'm highly affected by color. Highly affected by color. It actually affects my mood. Yeah, see the cups on the
Those
table,
are
right?
cups.
It's all magic.
But to be so sensitive to notice that this resident or this patient was drawn to that color orange, and noticing that her environment was all bland.
Right.
And that it would help her to see the door with that note on it. I mean, I'm just so touched by that story.
Right.
And
then there's,
I'm sorry,
yes,
you
go ahead.
mentioned something about cameras. Do a lot of people, a lot of patients have cameras? I mean, today with technology and things like that, do people actually have cameras in the home to watch?
There's actually a lot of devices that are out there. You can put it on your iPhone, where families have, where if you go out a certain range, it will alert them. So I think, any technology that we can use, I think it's to our benefit. And so those were families that put that in. And I think, that's an invested family, and I think, it brings safety to the individual, and it also brings safety and peace of mind to the care partner.
I'm assuming you don't see that too often.
I think it varies. Yeah, I think it varies. I mean, I've seen it quite a bit.
You'd think that in today's technology would be something that any caregiving child would want to have that in the house.
Right, right.
And so some of the topics, one of the topics that's very hot right now in the caregiving community is, where do people go for support? How do you know when you need support? What are the signs to look for? And I feel bad for some of my friends who are caregiving to their senior parents, because they're really stressed out. And I'm trying to tell them to maybe look into taking a day off, getting some help. And usually they feel that they're the only ones who can do it. Nobody can take care of mom like I can. And I'm sure you've all run into that. Did anyone want to speak to that?
I can speak to that. I think that we're blessed by where we're located in New York City. I think that, this is an area that has so many things to offer, and it's for free. So we have a lot of organizations that we've partnered with. Caring Kind actually offers education to families for free. They will train the home care aide that's with their loved one. They'll do that. They also have support groups. They have in-person support groups, and so they might be spouses or they might be daughters, whatever it may be. There's a support group out there, and it doesn't have to be right in Manhattan. They go deep into all of the boroughs. And again, the main thing is it's free. Like, these things are out there. They also have, if you need more, like, kind of one-on-one counseling, because if they're in such distress, they have social workers there, and they have this hotline you can call 24 hours. And then there's also the Alzheimer's Foundation of America. And the reason why I mention that is because you mentioned, I'm the only one that can take care of my loved one, and you feel uncomfortable leaving the home. So they have telephonic support groups. And I think that's important, because they've got to feel supported, but then how can you be focused at a support group when you're worried about your loved one?
Yes.
So if you're in the home, maybe you can go to another room and be connected telephonically.
Yes, but there's a lot of people out there who don't even realize that they need some support, and I can see it all. I have a friend right now it's all over her. It's all over over her face, her demeanor, her eyes, her body move. I mean, I see it. I'm not even a professional.
It's funny you said this. We meet people financially. I always say people come to the office, and I feel like a social worker. For the first half hour, I'm just listening to them ramble on because they have to get it off their chest.
Yeah.
Right.
And, that's part of what we have to do as professionals all the time. It's like, let's just deal with the financial. I can't do that. We have to, go through it. I have to tell me about the hospital, and this doctor was lousy, and that doctor was great. And, they just have to get it off their chest. And it's very, very important to listen to people. And I feel that's really our job as caregivers.
Yeah. And ICS, we really try to create a community. We also always talk about the ICS family made up of our member-centered care. And so that revolves around the caregiver, family member. And we also have social programming. We bring our members into our locations in our downtown Brooklyn and Bronx area, and we do a bunch of different social programming. We also have a member council where every 6 weeks our members can come in and they can really talk to our senior leaders about what they, whether it's positive, negative, we take that feedback and we really craft programs and services around that feedback.
How often do you have those meetings?
That's every 6 weeks.
And where are they held?
In our downtown Brooklyn office most of the time, and sometimes in our Bronx office as well.
And how do you let the members know about this?
Well, it's on our Facebook, social media. We have a publication that we send out to our members every other month, I believe it is, and it's mentioned there as well. And
so the leaders of your organization care so much about the members that they hold these town hall meetings with the members. I'm hearing you correctly?
We have senior leaders, and sometimes we'll even have our president there. So we really talk about that ICS family, and it's really important for us to make sure that they're tapped in and they're feeling comfortable. So when you talk about a caregiver, for example, who's concerned about their family member, when they're an ICS member, we try to bring them into that family. So that's a real big focus of ours.
I know when I got some help from Ellie's office with the Medicaid application for my mother-in-law, there was a point where I started crying, tissue box right there. We're used to it, here you go. And he starts handing me the tissues. They're just used to this because it's a very emotional time for families.
I'll tell you, interesting, I started working, I don't want to say how many years ago. I'm working already 30 years in this field. And I started working in a nursing home. When I started out, I was putting in census information. A patient comes in, a patient leaves, and sometimes people die. I had to work very hard to become sensitive that we're dealing with human beings. We're not dealing with numbers. We're not dealing with, these are people. Yeah. And, I find that for the most part, the caregivers that I work with, and, to work with professionals and whatnot, people are really keyed in to realize that we're not just dealing with just another number. We're dealing with a person, their life, and they have a lot of history in their life, and if you actually spend the time to listen to people, it's amazing what you find out. I think you alluded to that before.
Right, absolutely. If you really do take that time to listen, you just, first of all, you learn because they have so much wisdom to share. And I think, bringing back kind of the care partner and, they're so stressed out and what do we do for them as well. We actually just became a certified music and memory program. So, one of our goals is so that, music is so involved in all of our life. I mean, you go shopping and they're piping in music, so it's there. And so what we've done is we have nanos. And
what is that?
It's a little small iPod. I don't even think they make them
How do you
anymore,
know
but we
that?
got them.
You gave them that one as a gift.
Yes. So what we're doing is we're meeting with members and their care partner, and we are working with them on what music that they like, and we're putting that into the nano so that they can share something together again, right? So we're finding ways for the care partner and the loved one to make those connections again, because that's important to bring down those stress levels.
Well, thank you so much for coming on the show, everybody. This has been very enlightening. I see your organization as one that cares and connects. You were talking about that a lot. I hear this theme throughout, that you're connecting the members and you're caring for them as well as the entire family structure.
Yep.
So we've enjoyed having you on the show, and we hope that you'll join us again.
Thank you.
Viewers, you can reach the organization by following the website and the phone number that will appear intermittently throughout the show. Thanks for watching. We're on every Tuesday night in Staten Island. We can also be seen in the other boroughs, on social media, and on YouTube. Bye now. Thank you.